Thank you. Good morning. Welcome to our webinar here on this Friday morning, where we'll be talking about our engagements in health. Really delighted to have with us folks from both Mercy Investments as well as from ICCR, as well as our own members here.
I'm in a webinar.
What's that? Oh, delighted to have you all here. We'll be placing people on mute initially, and if you've got a question at some point, you can unmute yourself. If you move your cursor into the lower left, you'll see the microphone. You can click that. We'll also be posting on our website later this recording, as well as the slide deck from this, especially for those who are unable to be with us right now. But also if you want to review some of what we've been talking about. I think that basically covers it in terms of some of the initial arrangements. Frank, I know you had a few words you wanted to offer as well.
Yeah, let me first of all welcome all of our members and our guest speakers. Thank you for coming today. Health is a priority issue for ICCR. It has been for many years. And that's partly due to the fact, it's due to the fact that many of our members are involved and have been involved in healthcare, both in dealing with direct care through hospitals and managing hospitals, as well as dealing with people who are lacking healthcare and trying to, with direct services. Many of our members at SGI have been involved in healthcare. The PBVMs, the Sisters of St. Agnes, the Franciscan Presentation Sisters, Rochester Franciscans. Many of our members operate hospital or have operated hospitals in the past. It's also, we've been very engaged in the health area, both in dealing with the tobacco industry, but also in the pharmaceutical industry and in our engagements with Merck over the years and with the medical device industry. So we have a rich history in health, and that's why we felt that a webinar focused on health would be of interest. One last word. I think ICCR and seventh generation members have a unique position in health. I think we're the only investor group really focused in this area, whereas in other areas of climate change, in some of the other social areas, certainly in the governance area, you'll have many different players, many different actors. In healthcare, it seems to be one that doesn't attract the NGOs as much, doesn't attract certainly the large institutional investment houses. So it's really up to us to be a voice for the voiceless in this sector. So that's why I think healthcare is so important for ICCR. With that, I'm going to turn it back over to Chris, and I'm looking forward to an exciting discussion.
Thank you, Frank. And yeah, all told, we have engagements with 9 different companies in the health area, be it from the tobacco side of the question or the 6 pharmaceuticals we're engaged with. So it's really an important commitment for us. Sister Ruth is going to lead us in a little opening prayer reflection. So I'm going to, okay, you're unmuted. So we'll pass it to you, Sister Ruth.
Okay, so let us just pause to remember that the all-powerful God is present in and around us. A reading from the first letter of St. Paul to the Corinthians. As a body is one, though it has many parts, and all the parts of the body, though many, are one body, so also Christ. For in one Spirit we were all baptized into one body, whether Jews or Greeks, slaves or free persons, And we were all given to drink of one Spirit. Now the body is not a single part, but many. If one part suffers, all the parts suffer with it. If one part is honored, all the parts share its joy. So as we come together today for this webinar on health, we can take literally the words, now the body is not a single part, but many. If one part suffers, all the parts suffer with it. But the words of Paul, who's writing to the early Christian community, apply to any community, to seventh generation, to a corporate entity, our nation, the world, the universe. So we know that if one part suffers, all parts suffer with it. And if one part is honored, all the parts share its joy. And so we pray. All-powerful God, you care for all your people, but have a special tenderness for people who are sick and suffering. We ask you to enlighten our minds and strengthen our wills to carry on the healing mission of your Son, Jesus. Touch the hearts of legislators, corporate leaders, the medical profession, all of us who are part of seventh generation, to be in such awe of each person that we will be compelled to act always out of love and compassion. So loving God, we thank you for being with us. Encourage us, we pray, in our struggle for justice, love, and peace. Amen.
Amen. Thank you, Sister Ruth. Frank, could you start the slide deck? Okay, and if we go to the next slide, you see a little itinerary for the day with our introduction and reflection. We're going to be starting with downstream health, as it's labeled here, drug pricing and global health. Then we'll go to upstream health, looking at nutrition, opioids, and then tobacco, getting involved, and discussion. Frank, shall we slide to the next one? And in this portion especially, then we'll be hearing from Meg Jones-Monteiro. Meg, I'm sorry I didn't get the slide in with your picture here. Meg works with, is responsible for leadership in ICCR of shareholder engagement and advocacy on global and domestic health issues. She provides leadership, expertise, and strategic direction to help develop and implement coalition members' shareholder engagement strategies with corporations. She also supports our engagements with corporations, including companies in the pharmaceutical, health insurance, food and beverage, and other sectors around access to medicines, access and affordability of healthcare, and emerging public health issues. With that, Meg, I'll pass it off to you to begin kind of walking us through, or am I getting that wrong? Is this you at this point, Donna?
No, you have to unmute her, Chris. Okay.
I will get down here to Meg. I'm not seeing her phone right now. Oh. Frank, can you help me get her unmuted? I'm not seeing her.
Okay.
I'm seeing her computer access, but, oh, there it is. Okay, I've got it. Okay, go ahead, Meg.
Hi.
You're now unmuted.
Great. Okay. I don't see the slide deck, though.
It's coming back.
All right, here we go. Okay, first of all, I just wanted to say good morning to you all. Thank you both to Frank and Chris for providing me with the opportunity to have this conversation this morning. As Chris mentioned, I am the program director here at ICCR for the health work, and it's really sort of now characterized as under health equity. And really quickly, I think that Frank already, and many of you already are very familiar with ICCR, which is a sort of the pioneering organization which has been using shareholder advocacy as the mechanism through which to sort of change corporate policy. We have 300 global institutional investors, over 400 billion in managed assets. And as Frank said, we really are the leaders in health and healthcare, which I think gives us a really great opportunity to figure out how to sort of push health forward. I would argue, you know, the other areas that we focus on here at ICCR, food, water, climate, and maybe this is also my personal bias because my background and training is in public health, but I actually think in human rights, you can tie all that back to health, which makes it a little bit more challenging to try to figure out how to focus our efforts within the health sphere. But I think it's fair to say that ICCR's work has helped sort of shape or lead to sort of the ESG issues that sort of have evolved prior or post ICCR's work in shareholder advocacy. Chris, can you go to the next slide?
That's actually Frank has it. Frank, can you slide
Frank,
that?
sorry. Great. And so as I mentioned, as the program director for health equity, I find this visual to be really helpful. So what we're looking for and what we see is really access to health is a human right. And it's not about equal access to healthcare, it's about equitable access to healthcare. And what this demonstrates is that not every person or every community needs the same amount of assistance, but rather, you know, you see the sort of the picture to the right, the person closest to the tree is actually going to need a lot more help and assistance in order to sort of meet that tree in order to get that apple. One of the things that's really important to remember too is when we think about health equity, where we work, eat, live, and play greatly impacts our health and the health of communities. And one thing that really has resonated with me is I had an opportunity to listen to Dr. Otis Browley, who's an oncologist that works for the American Cancer Society. And he once said, it's not about, your zip code does not determine how you live, rather it determines if you live. And to me, that was a very poignant remark because what it really stresses is health is a very complicated thing to understand, and it's also a complicated thing to measure in some respects because there are so many things that influence our health. And by health, I mean both physical and mental well-being. Next slide, Chris. Great. So I believe that you all have probably seen our health plan, and I know that Frank and Chris may have sent through our domestic health principles as well as our global health principles. So I'm not going to spend a lot of time on this, but these are sort of our guiding principles that help direct our work. So really on the domestic front, we're focused on health security, access, quality, accountability, and equitable financing. And I think the thing to remember is that there are a lot of stakeholders and players in the broader healthcare landscape and health landscape. But what we really want to make sure is that people are getting the right care at the right time at the right cost. So really and our influence as sort of investors and shareholders is trying to figure out how to influence corporate policy and practice. So for this year, our main focus, at least on the domestic side, has really been trying to figure out how to work with pharmaceutical companies. So understanding that the pharmaceutical companies that investors hold in their portfolios, trying to figure out how to bend the cost curve, right? How do we improve access and affordability for consumers? In addition to that, part of our work plan did actually refer to working with health insurers. We understand, obviously, that you can't just work with one stakeholder because all of these things are very interrelated, but we don't have as robust a work stream on the health insurance side as we do currently on the pharmaceutical side, and that has been primarily due to bandwidth. Next slide. And so this is really just a slide to articulate, ideally, you know, when we understand that what we're trying to do is get pharmaceutical companies to make drugs and medicines more affordable to people, is to also understand what does health look like in the US. And this is just an example of, you can see, specific to diabetes and obesity, obesity being a risk factor for diabetes, that from 1994 to 2015, there has been an increase in obesity across the US. And I'm sure this is not something that you're unfamiliar with. Similarly, the connection between obesity and diabetes, you'll see, again, 1994, you look at the maps, primarily, you know, yellow, dark yellow, and you look at the 2015, and it's rather daunting to understand that diabetes is one of the most important diseases, at least at this point, that impacts not just death and mortality, but it also impacts disability. So I just wanted to quickly throw out a couple of things. When you think about what causes the most deaths, and this isn't necessarily visually represented on this slide, but diabetes in 2005 ranked number 9. In 2016, it ranked number 7. So one could argue that we've done a little better with respect to mortality. Similarly, what causes the most premature deaths? You see in 2005, it's 5 ranking, and in 2016 it's 11. So it seems like there's been some progress related to that. However, when you look at what health problems cause the most disability, in 2005 diabetes was ranked as 9, and in 2016 it's ranked as number 6. So you can see that maybe people aren't dying from diabetes, but in terms of disability and management of chronic long-term diabetes is certainly something that a lot of people are contending with, and it has a huge economic and social impact on people living in the United States. The causes of death and disability combined, diabetes is number 6. And actually for drug use disorders is even higher at 3. So you're going to hear from Donna Meyer later on about our work focused on opioids. Next slide, please. So you see that there's a very high incidence and prevalence of diabetes in the country, right? So what is the problem? In order for people who are living longer with diabetes, there's a need to manage diabetes. So this is a really interesting graphic because it shows 1 in 11 people in the US has been diagnosed with diabetes, and that's expected to increase to 1 in 3 by 2050, which is huge. The cost of diabetes in 2012 was $240 billion. And why is this? Primarily because of escalating drug costs. Spending on insulin and other diabetes medication is expected to rise 18.3% over the next 3 years, which is a rate of increase 60 times greater than the recent income growth. That is astounding. And that is why we here at ICCR, as well as you all, are doing this work. Next slide. So before I go to this slide, the one thing I want to say too is the reason why there's and we probably have experienced this, or others have experienced it in their families, is the result of high drug costs really can lead to the inability for anyone to fill a script, or it leads to rationing, which means that you have lack of adherence, you have uncontrolled diabetes, which then can result in heart disease, kidney disease, and blindness. I think I want to go back to sort of the 1 in 11, what is the problem? The other thing is that we have different groups that are disproportionately impacted by diabetes. So what this shows is part of what we're trying to make sure that we do at ICCR is make sure that those that are most impacted by these diseases are the ones that have equitable access. And so this kind of just shows you that, you know, Black, non-Hispanic, Hispanic, and American Indian, Alaska Natives are the ones that bear most of the burden of diabetes. Next slide, please. So what does that mean? What does, where does ICCR fit into this? Where do you as investors fit into this? So this is really what we have outlined in our work plan. This is what we want companies to do. We want them to disclose the extent to which risks related to public concern over drug pricing are integrated into compensation policies. We want them to publish drug pricing transparency reports. We want them to develop new initiatives in response to the SDG 3, which is focused on health, work to reduce the occurrences of drug shortages, disclose all clinical trials, improve their reporting on their impact of access strategies, improve disclosure of R&D costs, improve disclosure of lobbying expenses, and demonstrate their commitment to refrain from anti-competitive practices. So this is all really easy to do, right? No, it is not. So right now, so there's been a long-standing history, and Frank and certainly Donna can speak to this, but the thing about ICCR members is that they've had really long-standing relationships with pharmaceutical companies, and this extends back, years. And so the strength of these relationships has sort of allowed us to have these continued dialogues, open dialogues, honest dialogues with these companies to help sort of push the envelope. So this year, really what we're focusing on, in addition to the ones that are listed below, but we've filed several resolutions with 5 companies on that first bullet point. So disclosing the extent to which risks related to public concern over drug pricing are integrated into incentive compensation policies, plans, and programs for senior executives. So we're going to talk a little bit about that next. Next slide. But before that, this just gives you a sense of sort of process. So how does ICCR work? We identify the issue and develop objectives or asks, then engage the companies in dialogues around these objectives. And then if those dialogues do not end in the result that I think members desire, then the opportunity to file a resolution sort of arises. Continued engagement and more dialogue, settle or ensure in resolutions get on the proxy, and then develop campaigns to get out the vote. And the one thing I didn't actually put on here, which I think is important, is really then evaluating efforts. Did what we do actually work or lead to the outcome that we had intended? Next slide, please. So this is the company selection criteria, and Donna, feel free to chime in because I have, admittedly, I've been here at ICCR for only 3 months, so Donna is certainly part of the architect behind some of these resolutions, so feel free to jump in. But essentially, the 5 companies that were selected this year to submit the resolutions around executive compensation were cited in a Credit Suisse report. And they were cited as having 100% of their earnings per share growth in 2016 attributable to pricing increases. So in previous years, there were resolutions that were submitted around specifically asking for transparency around how drug prices were developed. And we unfortunately, investors did not, the SEC did not support us in those resolutions. But this time around, we had in addition to the health group, we had a lawyer, Beth Young, who is also the architect of the development of these resolutions, really say this seemed like it was a really good strategy to try to get more disclosure and transparency from these companies. And so the ask is understanding and seeking greater disclosure of the role of compensation policies and practices. You can go to the next slide. And just a bit more on the resolution. Again, it's not prescriptive. It's really asking for transparency and disclosure on how they're doing it. But this just gives some examples of why this is important and why a shift, getting companies to think as shareholders the importance of thinking of long-term investment in instead of short-term return. So again, choices made around pay metrics or performance measure period. So what does this mean? It could be drug development milestones, targets for R&D investing, meeting targets for pricing thresholds, adjustments to metrics to limit the impact of price increases, such as in share buybacks, or consideration in qualitative individual performance assessments. And so really it's understanding the metrics that are used to inform compensation packages and making sure that it's not just based on, you know, we need to meet a certain target, so the way we do it is to just increase drug prices. Next slide, please. And this is an example resolution that was submitted to the company Eli Lilly and Company, and the companies to which we actually submitted resolutions are Eli Lilly, BMS, Amgen, AbbVie, and Biogen. And the great news is, and we'll get to that later in terms of action, is that the SEC staff sort of ruled in our favor. And so we have all of these will be on the proxies of those 5 companies, and the AGM meeting, the first AGM meeting, will be happening in May 1st. So we have at the end of the deck, there's a slide that includes all of the exempt solicitations as well as the dates of those AGM meetings.
And Meg, if I can just interject, we actually have members who were co-filers on all of those resolutions. So like this one that you're looking at, Sister Judy Sinwell, who's on this was a co-filer of that. Dana with Ann Roberts, who's on, has also been a co-filer of 2 of them, AbbVie and Amgen. And then Father Robert Watipka of the Capuchins also had filed with Merck and Pfizer, but I forget which one of those was the one that was omitted, but yeah. Yeah.
Well, thank you all. Your efforts it's amazing to sort of see the press coverage that we've got. I think we were all really excited that the SEC staff ruled in support of us. And now really what we're trying to do is get the vote out there. So everything we can possibly to let investors know and encourage them to vote for these proposals.
If I might even add, one thing we could do then, we have each of our organizations have websites and things like that. So maybe a little nudge might be that some of our communities, some of our religious orders might be able to kind of lift up in some of their communications this resolution, encouraging people to support it, huh?
Absolutely, yeah. You can go to the next slide. Great. I think I'm almost at my time here. So this is the example of our global health principles, which I actually don't think are that different from our domestic health principles, but we know sort of our unique health system in the United States runs completely differently from sort of the rest of the world. And I would argue that we are definitely not a model that anyone would really aspire to. But on the global front, really what our focus has been for quite some time has been on access to medicines. And I think that there have been some, Donna can attest to this, and probably Frank too, the global health space may actually be really where ICCR started most of their efforts and sort of established themselves as a leading voice around access to medicines. So you can go to the next slide. So one of the things that we've been doing sort of on the global health side, where we did not have a set of resolutions or a strategy for global health in the way that we did for domestic health this year, we're hoping sort of as we embark into our strategy session that's coming up is that we're going to help, have a more defined focus sort of within the global health space. But really, there's been continued engagement and dialogues with companies to try to, encourage them that they really do need to make medicines affordable in low and middle income countries. And one of the things that ICCR was very, sort of led the way with is really the establishment of the medicines patent pool. And so again, really looking at the long-standing, really trusted relationships that ICCR members have had with these companies, there's been continued dialogue around increasing the impact of their access strategy. So some of that is, it is around pricing, it is around having more disclosure around where products are registered in, country registration. It's also about issuing, through the medicine patent pool, voluntary licensing and compulsory licensing. But I think also what many members have been doing is also pushing these companies to develop more evaluative strategies. So when you talk about your access to medicine strategy, what are your targets? And then what are the metrics that you are using to actually evaluate whether you're reaching those targets? So some of the things that the investors and members have been doing is there are a series of different types of indices that I think the broader community has been sort of pushing pharma to use, one of which happens to be the Access to Medicines Index. So in dialogues with many of these companies, which sounds like many of you may have already been on, asking them whether or not they've been participating and also evaluating where these companies fall relative to one another, and some of these indices are important. So the access to microbial resistance is another indice that an index that is something that we've been, is new. So we are using that as a way to sort of help us plan our strategy as well. I think one of the things that we hear is that there are so many indices out there that sometimes it's hard for investors to know which one should be, when you're having that dialogue, what should you be asking about? And on the side of the company is, well, when there's 10 different indices that we need to complete, which one actually makes the most sense for us when we have to think about resource burden and what is actually of value to us in the broader community. So this is just to show, though, that these types of indices are important and can help inform and sort of push companies to do better. And I believe that is, with that, I can hand it over to Donna. One of the things that I was talking more about sort of the downstream, so the treatment versus prevention, and Donna's going to be talking more about sort of upstream, which is more of the preventive piece of health.
Thank you, Meg. And just so you know, Meg has been great to work with in preparing this in the midst of a very busy week, and also really delighted then to be able to pass you on to Donna Meyer now. Donna is the Director of Shareholder Advocacy for Mercy Investment Services. She's been that since 2013, having started with Mercy in 2012. But she's not new to working in healthcare, as I discovered. She actually has been a healthcare administration, has worked in healthcare administration, even actually has a terminal degree in preparation in public health. And so apart from having a real specialized education and preparation experience in the area, she also, I find, is somebody who is excellent in communicating in very clear ways the issues and the things that are at stake in this. So with that, I'll pass it to Donna. Thank you, Donna.
Thank you, Chris. Does everyone hear me okay? Good. Yes. Okay. It would be nice to be there in person with you, except for your weather, of course. I sit in Houston, Texas, where it's 72 degrees. But anyway, I won't rub that in.
Well, I'm sorry you're putting up with such heat.
I've seen the snow shovels at work in your part of the country recently. Frank, in his introduction, mentioned that ICCR, which is a faith and a values-based investment organization, really is the leader in healthcare more than a lot of the big corporate investment firms are. And I think that's very important to understand how every single one of the faith traditions somewhere in their documents document the importance of healthcare as a human right. I think Ruth did a nice job in her selection from Paul this morning, which clearly indicates that the Christians take this very seriously. But I must tell you that our Muslim member filed one of the healthcare resolutions this year. Every Christian faith, it basically believes that healthcare should be a right and should be affordable and accessible to all. So we're well represented by every faith tradition in this push to better health for our fellow man. But the definition of health, I think, is something that, as Meg said, we will always debate. Is it, for example, the treatment of disease? Is it to find pills for those who are diabetics? Or should our emphasis be on healthy eating and exercise so we lower the rate of diabetes in our country? And I think if we're concerned about costs of healthcare, which we clearly are in working with these drug companies, we're concerned about costs and costs internationally too, not just in our own country, but in other countries. Should we be providing mosquito nets instead of treating people with malaria? It's a similar question. We've got to approach costs from two angles. One is the actual costs of the products and services themselves, and one is, can we keep people healthier so that we don't need all of these products and services? And I think that you all in your own communities can work on this latter issue. It doesn't take anyone in Washington, it doesn't alone take Washington to fix it for us. We all need to be part of it. I do think there are some people that say it's all individual responsibility, and I will argue in the next few slides that these big companies play a huge role. So it's not just individual responsibility. But Frank, if you go on to the next slide, I promise not to talk about tobacco, because I know your colleague Marty will be talking about tobacco. But since both Chris and Meg alluded to the fact that I've been around a while, I may as well tell you that my first work in at ICCR was actually with Mike Crosby, who I think every one of you knows well or knew well, and tobacco over 20 years ago. In fact, my first win was when we got the Eckert's drugstore to quit putting an advertisement for tobacco in the middle of their Sunday ad. Between, on the top of the page was toys. If you remember, those of you old enough to remember, the top of the ad page was always toys, the middle was tobacco, and the bottom was candy. And so they were doing everything they could to push cigarettes on young children, basically. And we got them to agree that they would no longer advertise cigarettes in the Sunday paper. And of course, Mike went on for many years to get them to agree that they shouldn't be selling cigarettes after they became CVS. So the reason for mentioning that history of tobacco is the topic I want to talk with you about today, if you move to the next slide, is nutrition and junk food, basically. Which is almost exactly the same as my memories of working with tobacco, because not only are these companies manufacturing food that has far more calories than it has food value, but they're finding unique ways of selling the stuff to us and our kids. And we might say, well, this is personal responsibility. You should not eat the food that's pictured here. But you've got to remember that young children are very impressionable. And so when they start pushing ads to young kids, they spend billions of dollars pushing these ads, and a mother and a father together and their best efforts sometimes can't counteract from all the money that's spent. The next slide shows us a picture of actually how much is spent. And if you look at the food permit, you know, we're encouraged to eat breads and fruits and vegetables and dairy. We're encouraged to only indulge on sweet foods for our birthdays, for Easter, for Christmas. You know, I think we all deserve to indulge a little bit, 5-10% of the time maybe we should indulge. But look at on the right-hand side where money is spent on advertising. Have you ever on your TV heard an ad for broccoli? I think not. I think not. I think there isn't such a thing. I did try to watch myself, and I do see that there's an ad for avocados from Mexico. You've seen that jingle probably in your part of the country too. But basically, the food that's advertised is pretty junky. And so we have all these innovative new products now coming out, like Lucky Charms Frosted Flakes, chocolate frosted flakes. I could go on and on. And so what are we doing as investors? We are trying to, number one, encourage these companies to produce healthier products, basically to cut out sugar, cut back on salt, produce healthier products. Number two, label their products so people know what they're buying, and the label is very clear, not some little fine print that we don't have strong enough glasses to see. And then third, not advertise inappropriately. And we're working with restaurants, we're working with grocery stores, we're working with manufacturers and pushing all of them to offer healthier products and to promote those healthy products. And we're making progress, I must say. You know, Target, for example, has made huge, I don't know if you notice it, but I see it in my own store that they're now featuring fresh foods and healthier products. Kroger's is making a big push. The restaurants have taken sugary drinks off their automatic menus for children. And did you read in the news, I think yesterday, that Baltimore voted that restaurants in Baltimore could no longer have sugary drinks as part of an automatic menu for children. So that we're making progress, there's no doubt about that. But then what happens if you look at the next slide, which is from a recent New York Times picture, if they can't sell the food to us, guess who they try to sell it to? They actually will stand at the street corner and give out Kit Kats so that they can try their wonderful new candies in countries that can least afford it. And so I think always our eye is on who is the most vulnerable and how can we make sure that they're getting healthy foods, that people in the United States are getting bananas in their corner grocery store, not just cigarettes and candies, and that people in other countries as well. Obesity is now a bigger issue worldwide than malnutrition by far. And estimates are that about a third of the population, both in the United States and in other countries, is either overweight or obese. So it's huge, and as Meg showed you in the slides, I don't think I need to repeat that, it is causing huge health issues, so that diabetes, heart disease are far bigger health issues today for us to handle than are the traditional infectious diseases. So the next slide basically shows that when we talk about marketing, I think we all think of billboards and TV. At least people my age think of billboards and TV. And actually, marketing is much more insidious than that. I don't think we have a good handle on what happens in the social media, and we're really working on that. That's one of the things I'm hoping Meg can help us get better data on what goes on in the social media. But there are also other ways. They'll package these foods and perhaps formulate them so they're healthier, so that they can give them out in schools. You know, the chips, little packets of chips, so that they meet the requirements for schools, but they have the same outside packaging as the big packets in the grocery store that are not formulated as being healthy. That way the kids will encourage their parents to buy the big packets. And this one I thought was rather unique. Hostess, they got a tax rebate and they're advertising that to all their products. You know which side of the political aisle they're on. They're advertising to all their workers about the big rebate they got in taxes. And what are they going to do? Every worker gets to pick a free product package every week of all their healthy foods. So I just wanted you to realize that that advertising is much broader, promotion is a much broader word than just billboards and TV. And the next picture, some of you work on obesity locally, which I really encourage, because one of the things about the work we do as investors in the social arena especially is that we can help make a difference, but to change social norms really requires all of us working on it from different angles. So some of you perhaps work in schools, or you work at your local communities and try to encourage people to eat healthier food. Some of you I know have social justice departments that work at the state and federal level. And taxing soda is a way to encourage healthier choices. And so I just want to say good luck to all of you. We've all got to work together to make a difference in this obesity crisis. The other major crisis in our country that I want to talk about in addition to obesity is on the next slide. And unfortunately, you've heard too much about this one as well, and that is the opioid epidemic. If you go to the next slide, you see that the opioids have been estimated to kill 500,000 people since the epidemic began in the late 1990s. And I wish I could have found a slide that has 2017 on it, because those numbers are out. And unfortunately, they are even higher than the 2016 numbers. So the chart would look even more dramatic, I guess, if that's what you're looking for. And you talk about deaths, which is, of course, very, very serious. But what is more difficult to measure is the impact on our economy, quite frankly. They say that every single day, there are at least 1 million people in the United States between the ages of 24 and 54 who are not working, not able to work because they're on opioids. That's 1 million people out of our labor force on an average day. So it is a huge financial impact. There are estimates of it. Some say $1 trillion. I don't even understand those numbers. I don't know how many zeros you put after a one to get to $1 trillion. But it's just a huge impact. And the deaths are greater than the deaths from automobile accidents, from any other cause in the United States today for people of that age range. So it's just a huge problem. If you want to go on to the next slide. So we decided last summer that we ought to start working on opioids, because some of the state health departments were actually calling us and saying, why in the world aren't you helping us with opioids? Part of this collective impact, like we were talking about for obesity, opioids require a collective impact, people working at it from every angle. Usually when we start a new issue area like this, and Frank can tell you this as well as I can, usually you get 5, maybe 6 colleagues the first year you work on it, right? And then maybe you get 10 or 12 the second year, and you gradually build up momentum. We began work on this in July, and by October we had 44 institutional investors working with us. 27 or so are from ICCR, and so that big blue sector of the chart is the what I'd call faith-based investors, because that's based on numbers. But when you look at the 2.2 trillion under assets, I can assure you that most of those assets come from the asset managers, the labor funds, the state treasury offices. So they've brought a lot of clout to us. There are 2 things to point out about this. First off, we have a lot of clout, which is really helpful in working on this issue. But the second that I think we shouldn't forget is that we've finally brought people to work on a health issue who aren't the traditional suspects. We finally have people outside of ICCR. It's required a little of adjustment for me because I'm not used to working with some of these folks, and some of them look at these issues in a different light than we do as faith-based investors. But I think it's very educational, and it offers lots of opportunities for working together in the future. So if you go to the next slide, these are the companies that we're working on, and if you look at the first group, which is a group of drug manufacturers, you see that there are a couple, one at least familiar name there, J&J. Everybody probably holds J&J, and Mallinckrodt is fairly familiar from the olden days, although it became private for a while, and it's just back in the public sector again now. And then you look at the bottom group, which are the distributors, which some of those are operate in your home territories. On both of these, what we're asking for is, are you carefully overseeing the manufacture and distribution of opioids? How are you doing that? And do you have independent board members who are helping to oversee this? So we're really focusing on oversight of the product in different ways. One of the resolutions is called a clawback resolution. And in that case, we're saying, you know, if somebody gets a big bonus based on an inappropriate sale, we think the company should have a mechanism for clawing that back and reporting that they did so to the shareholders. So you see all of it is related in some way to oversight. For that middle group, which produce the antidotes or the treatments for opioid addiction, our focus is a little bit different. Those drugs we want available, and so our focus has been on price, because they have lobbied hard and heavy to make sure that every first responder has to keep an up-to-date antidote on hand. Every school, they'd like everywhere to keep up-to-date antidotes. And of course, while they're lobbying for everyone to have antidotes, they up the price 10, 15, 20, 100 times what their previous price is. So that group, it's a pricing issue again. And then I think there's one more slide here, or two more slides. Yeah. And so the good news from the opioid coalition is that we've had a lot of success. We're making lots of progress, partly because of the clout. And I think everyone realizes that this is a really important issue for the country. So where things are going to votes, we're getting high votes. But more often we're settling before it even goes to vote, and the companies are agreeing to improve their oversight. And is there one more or two more slides I'm supposed to do? Oh, so we made a success. We're celebrating, clearly we're celebrating our success, but if you move on, and we should, I mean, I think we've done a lot of great work. The thing for you all, before I turn this back over to Meg, I think I'm supposed to, the thing for you all is to be sure you vote your proxies, especially on opioids. Meg mentioned that we want you to vote on all the drug issues that we're working on that have to deal with executive comp and drug pricing. Most of you already have guidelines that would include voting for those. Most of us, especially those of us that use Catholic voting guidelines, do not have in our voting guidelines that we should vote on opioid resolutions. We have submitted that proposal to ISS. I am quite certain that by next year there will be a voting guideline for opioids. But for this year, you really have to read the resolutions and decide that you want to cast a vote in favor. So I hope you will do that. I think that, Meg, are you still on the line, or have you signed?
I am. I'm still here.
Do you want to wrap this up?
Sure. So as Donna said, we want, you know, investors to vote your proxies. So this slide at least gives you links to the exempt solicitations for 4 of the companies. So AbbVie, Amgen, BMS, and Eli Lilly. We are still in the process. Once Biogen is up, we'll make sure that that we send that to you as well. And then these are the AGM meetings that are happening. And there will be an ICCR member at each one of these AGM meetings reading a statement in support of the resolutions that were filed. So certainly share this. And Chris, like you said, maybe, you know, if, you know, your members are willing to put something on their websites, I think the more that we can get this out there, the better.
Thanks. Marty. Marty Roars is one of our members. He's the co-director of the Justice Office for the Sisters of St. Joseph of Carondelet. And so, Marty, let me make sure that you're off mute so that you can. Here we go. Go ahead, Marty. Oh, not hearing you, Marty. Still not hearing anything.
Marty, you have to take yourself off of mute.
I've taken myself off.
Okay, there. We can hear you. The volume's a little low, but.
Okay, I will try and get as close to the computer as I can. Greetings, everyone. My apologies. I'm going to keep this short because I have to run to an 11 o'clock meeting. But in a nutshell, the Sisters of St. Joseph have worked with a coalition of other investing partners on tobacco resolutions. Mainly, it was with Altria. It was trying to get them to, 1, disclose their nicotine levels, and then 2, to get them to reduce it. That's been a bit complicated, they say, on their end, and but we are moving forward with the resolution and have had some good conversations with Altria. So I think that's the next slide there, Frank. It's produced some good dialogue. The board is against it. I mean, again, they don't see nicotine as the cause of cancer, so they're not moving on that one. But we've had some good dialogues. The second resolution that we've been working on, the next slide, is with Philip Morris. They are giving close to $1 billion over the next 10 years to a foundation for a smoke-free world. There wasn't a lot of disclosure of what their relationship was in giving this money to this foundation and helping to start this foundation, a smoke-free world. They have agreed to share their disclosure documents and their memorandum of understanding with the foundation, and so it's given us kind of a door and a window into dialoguing with them, to learning more, and so we've removed that resolution for this year just because it's provided us with information to better strategize for next year. I think the 2 big things with the tobacco companies in general right now, there's a huge move in tobacco companies to move to this, and they're using terms like safe smoking. So this whole movement of e-cigarettes or vaping or other ways, I think it's something that faith communities should keep basically in mind and watch, because I think there's a lot of movement in the tobacco companies. They see the growth in their markets for the future with vaping, e-cigarettes, and these seemingly safer methods of smoking, and they are targeting the younger and youth populations and poor communities of color. So I think it's, again, an area of growing work for all of us as investors.
Thank you, Marty. And your engagement in this area is really important to us as it continues that work that even Donna mentioned earlier, that has long been a part of our work as SGI and WinCRE before that. We'll also be talking about ways that people can engage with Marty and with the other actions here. So the next portion, the next slides actually kind of point towards those ways that we can all work together and coordinate our engagements.
Thank you, Kristen. I'm going to jump off the call and follow up with you later. But thank you all, and this has been very helpful this morning.
Thank you, Marty, for being with us.
Chris, this is Meg. I can do this one, and then I have to jump off as well. So this is really, in part, it's like, you know, it's great that we have all this information, but what can you as investors do? And I'm sure many of you are already familiar with what you can do, but we thought it would just be helpful to kind of sort of outline it. So participate in company dialogues, right? Engage asset managers to determine priorities. Tell your colleagues and friends. So even sort of outside of your normal professional networks, are there other individual investors perhaps that may hold shares in these companies, and they will be sort of issuing their vote? Join the ICCR Health Equity Group. So in case, you know, those of you who have not been active in the Health Equity Group, when you go onto the member website, you can sign up for that group, and then you will get notifications. I am happy to have conversations with you, calls, anything to help update you on what we're doing. So I think my contact information is on the last slide. I'm sure other members too, you know, Donna, who's here, just trying to figure out how we can get more people involved. Signing investor letters, becoming co-filers, which many of you already are on some of the resolutions that have been put forth. Attend an AGM. And so the other piece of what you can do is what can you do as an investor, but what can you do as an investor supporting direct action? So outside of sort of the investor world, there are other NGOs and other actors who are also focused on a lot of these issues. So are there any local events that you can attend on some of the issues that your organization is focused on? Working with other organizations or coalitions, attending demonstrations if that's something that your organization is able to do. One of the things that we're trying to do here is ICCR always has had a very long-standing relationship with a number of different NGOs, but specifically within the health space. On the global side, we've worked a lot with MSF. So we have that long-standing relationship, but we're also trying to foster relationships with patient advocacy groups. So Patients for Affordable Drugs, we're working with Public Citizen, really, you know, Bioethics International, KEI. So really trying to also understand how our efforts maybe connect with some of the other efforts that are happening on the ground. And then similarly, understanding, since many of these folks are on the ground and they can give us the color of what the specific issues are to help inform and focus our work as investors.
Thank you.
And any other ideas that people have too. This is just sort of a short list, but certainly open to those as well.
Excellent. Maybe what we could do now is, if people have particular questions, you can take yourself off mute. The way to do that is if you move your cursor to the bottom left-hand corner, you'll see the microphone, and just click there and feel free to offer some questions.
Chris, did you take everybody off mute?
Oh, I have not. I can do that. Let me, let's see. How do I?
Okay.
I'm missing how to do that right now.
Okay.
Oh, there it is. I see. Sorry about that, Frank.
Okay.
I have a question about research, funding research. Someone said to me just yesterday that the pharmaceuticals are the ones who are mostly carrying the burden of funding research, medical research in this country. And that's why our pharmaceuticals are so expensive. Now, I wonder, are there other countries where the government does all the medical research or funds that? And so those prices are down? Is that a facet to work on?
You know, that is an argument that the drug companies do use. But the fact of the matter is that a large lot of the research is funded by our taxpayer dollars. And so it may come from the NIH and the drug companies may direct it. But the drug companies actually spend more on advertising than they spend on research, according to the data that's out there. And we can share some of that data with you. We had a pretty dynamic speaker, I believe it was last September at ICCR, who had those numbers, the exact numbers. But the biggest, they call that development because when they're, to me it's advertising, but to them it's development, in that it's helping the doctors it includes helping the doctors understand when they can use the product and giving free samples and stuff like that. They spend more on that part of what they call development.
Are there any stats on the amount, the percent of the expense to pharmaceuticals are actually paid by the government?
Mm-hmm. There's some good data out there. I don't have it at my fingertips, but if you give me a minute, I can look it up for you.
Well, or after Donna as well, if you want to provide that with me, I can send that out to everybody.
Okay.
Thank you.
Donna, I have a question regarding the companies in our region, Upper Midwest. You had mentioned that we have some, but what are the names, and should we be more engaged with our local or regional companies?
Well, Chris is going to the Eli Lilly meeting. Thank you, Chris. On May 7th. That's in Indianapolis. That isn't exactly your territory, right?
Right.
But all of these companies have huge sales forces in your part of the country. Like McKesson is huge in Wisconsin. I'm not sure where you're from. Cardinal is your secondary vendor, and AmerisourceBergen, I think, follows behind in your part of the country. I can speak a little bit about it since I came from Minnesota myself. But you can get those figures, and some of them have manufacturing facilities. A lot of the corporate offices are in New York, like for Pfizer, and J&J is in New Jersey and so forth.
Donna, just a quick question that occurred to me, and I kind of know the answer, but it's an obvious question, so I'll ask. On the pharmaceutical pricing question, right? What's broken from a company perspective? Hey, we have record profits. We have been stellar growth. We have had superior returns for our investors. We have captured more of the healthcare dollar that is spent in the U.S. Pharmaceuticals are better than sending people to the hospital, which has been shown to be far more effective. More transparency in pricing is only going to bring us price pressure, which is going to be pressure on our profits. What exactly what are you trying to fix here?
Frank, you could make that same statement, I think, for almost the entire healthcare sector. In other words, you could repeat your statement for the insurance companies. You could repeat it for the medical device companies. So they're all very similar from that standpoint. From an investor standpoint, from people who care, what we care about is the long-term sustainability for these companies. And they could be healthier in the long term if they would spend more time and energy on developing new products than raising their prices to increase their profits. And so what our resolution actually asks, it doesn't say never increase your prices. It says, tell us about how you determine your long-term executive compensation. Is it based solely on increasing your prices, which is a very short-term strategy? Sure, it will bring you bonuses for this year, but what does it bring you 5 years from now? Or is your compensation also based on the amount you're spending on research, the amount you're spending on new development, the amount you're spending on expanding your product, which means that's a long-term strategy. So I think you have to think about the long-term strategy to understand where we think the pharmaceutical companies need to be focused.
Thank you.
I have a general question for everybody here. It has to do with sign-on letters, and I like the opportunity to sign on for the School Sisters of St. Francis, but I'm just wondering how much weight that has versus a shareholder resolution, which really does get the attention of the company. Are these sign-on letters really making a difference?
That's a good question, you know, and I'd love to hear Frank address it as well, because he could answer it just as well as I can. This is my perception. I think as people of faith, especially with our approach, and I'm saying that after working in the Opioid Coalition and working with people who really look at this business world from a little bit different angle, I like to know that I have talked clearly with the company before I file a resolution. I would like to explore how we can work together to achieve what we want to achieve, and I would like the resolution to be filed when I'm not making progress. And so I think a letter is a clear way of saying this is what we think, and it's signed by a lot of people so they can see that it's what a lot of people think. I don't know that we have good evidence in terms of how much it changes the practice alone.
I would say it's a crack in the wall, and as the cracks increase, the wall will come down.
Well, that's great.
That's nicely said.
We got to remember that one.
Well, and I think sometimes it's about what the letter asks, to whom it's directed, and kind of about timing. That on the whole, petitions and the like, elsewhere in the world at least, especially when we're thinking about politicians, don't have as much influence, say, as an actual vote at election time. And so likewise, the difference between a proxy and a petition or a sign-on letter has those kinds of weights, kinds of things. But when it helps crystallize what the ask is, and when it's being directed to somebody who has the authority to make a difference around that, I think that it at least clarifies where people stand. And insofar as it does that, it's helpful. And insofar as it might open the door to more dialogue, then it can be helpful. But there's also a way within which I suppose once they get the letters, sometimes they stamp the date that it was arrived, it went into a folder and nobody looked at it from their side, you know.
Yeah, I'll build on Donna and Chris's comments a little bit. I have the same question, Dan, as these letters proliferate, as our coalition gets more and more frustrated in the political and societal kind of challenges we faced as of late. My feeling, as Chris mentioned, it depends on two things, who's it from and who's it to. My sense is letters to companies has more impact than letters to Congress. If you look at the advocacy experts, they'll tell you, they'll give you a hierarchy of impact on actions, and letters are well below, say, phone calls, which is below, say, town halls, which is below, say, office visits. So Congress, you got to recognize, they get a flood of these things, and letters, I'm sorry to say, what Chris said, you know, stamp it and file it, happens a lot. The best you get is a response from the staffer. On the other hand, companies, that's a little bit more the way they work. And so companies, I think you have a little bit more impact. Secondly, on the sender side, two things. I think, you know, whether we like it or not, what gets a company's attention is how much ownership you have. That is important in many respects. So that's why, when BlackRock calls, they pick up the phone, right? Or Vanguard or any of the big houses. In fact, they go and make sure they visit those folks. So they get their personal or private visits. The small guys, we don't have a chance, right? We and this idea of, and I think that the opioid example was a good one, where Donna helped put together these 44 investors, 2.2 trillion. I mean, that dwarfs certainly any of us and all of ICCR, in fact. So this was masterful. But even that, relative to these big boys, it's small. On the other hand, I have seen where faith investors, whether it's through letter, phone call, or dialogue, we get what do they say? We punch above our weight. We get a voice that is, and I quite frankly, coming into this was surprised, and Mike tried to explain to me that companies see us as a credible voice. We're not out to shut people down, and we typically give them input they're not getting in the boardroom or from their consultants or from their polling data. So they have found, not all companies, but they have found that listening benefits them more than ignoring. And so I think who it comes from and where it's going, that is key.
Maybe I'll add one more thing, is that it also needs to be one part of a strategy. I mean, if it's standing on its own, it won't go anywhere. But like our recent dialogue with JP Morgan Chase around the private prisons, it was a question at the annual shareholder meeting. When we really didn't get the answer we wanted, a letter followed up by a phone call, followed by their return letter, followed by another dialogue. And it's progressing that way, I suppose. That in an isolated instance does probably little to nothing, but together when associated with other actions, it can be more powerful.
Maybe just one last thing on that, related to a response from the company. If it goes to the right party and you get a response, the sender, I would think, would receive a lot more encouragement, or the participant, I should say, would receive a lot more participation if we heard some feedback. I mean, was there a response? And then I was on that letter, so I'm going to sign another one to keep this going.
Yeah, I think that's something actually that would be on us then, to make sure that we're communicating back to you all when we hear of replies. And I'll pass that on to Meg as well. She's already dropped off the call. But to get that feedback and to kind of make the feedback loop work better. Yeah. Maybe a question.
I think the ongoing effort to knock off the small investor is kind of an indication that they know we're there and that we're doing something.
That's right. They don't beat a dead horse, or they'd waste a bullet if they were going after one that was already dead. The fact that we have impact is why they try and eliminate us. You're right.
Yep.
I think Dan's comment, though, about better feedback is so important, because we sign letters too, and we have to beg to figure out what happened to them. So we're kind of going back the last 3-4 years and looking at every one of the letters we signed to see if we can match up what happened, what did we achieve by sending that letter, to see if we can see some trends. But I don't know that anyone has really done that well, that kind of analysis.
Good. And it's not easy, right?
No, it's not easy.
Was it the letter? Was it other actions? Was it societal trends? I think that goes to Chris's point about a broader strategy, multiple tactics.
Mm-hmm. Maybe a question just to direct to everybody, following Dan's example on that. I know that a lot of you have considerable time restraints in terms of what you can do. That nobody has 40 to 80 hours a week of the members that are part of this call to be dedicating to this. And And so like when you think about time management and the places where you feel like you can use your time to have the most impact, what are those? That follows up on Dan's question about the sign-on letters. And what are the ways that make that most satisfying for you?
Well, for School Sisters of St. Francis and the time that I have to allot to this work, sign-on letters is a start for me. Even if we don't have the shares in that specific company, it gives us something to work on regarding the priorities from our congregation. And we want to promote whatever is happening, and some sign-on letters have been very instrumental in letting us do that. Regarding a shareholder filing, we rely on the portfolios that we hold, and in some cases, I can't address the shareholder resolution because we don't have ownership, and then that brings up the whole question about, do we carve out a section of our portfolio that's for shareholder resolutions only, and then that takes a year to build. So I think sign-on letters for me are very helpful. It does give me a feeling like we are doing something, but I would appreciate a feedback to see if a response came to that letter, and then to further encourage me to keep going.
Good.
I'd support the same thing. This is Judy, in that it's helped me. We've only done this for our second year. We're completing our second year, and having a sign-on, then educating our members about those issues has been important, just to open up the whole experience to the members as to the kinds of issues that we're able to have a voice in. So I find it helps me, and then being a co-filer has been really helpful because it helps us determine our focus, and we really are mentored in doing this. I don't at any point at this time feel I could be a lead filer, but the work Donna has been really important for us for 2 years to help us walk through this for the first time, and I think that's really been important for our membership.
So nice to meet you, Judy.
Yes, you too.
Yes. We really do appreciate your support.
Well, thank you. You've helped us a lot. So we have some confidence now with our feet on the floor for the first times to do this kind of action.
Mm-hmm. We've made a lot of progress this year. We all should feel good about it.
Yeah, I might just Judy, I understand your a bit reluctance on going from, I think it's great. You're one of our leaders on co-filing along with Ann out there. But I think, you know, I'll maybe boost up Ruth Garrett's now, but, you know, leading is certainly that next step, but we support you a lot in that. We, SGI staff, ICCR staff, support our leaders heavily, and it's not, to be the lead doesn't mean you're the, you know, you're the expert and have, what did Chris call it for Donna, a terminal degree? That's a little scary, right? You won't need a PhD in public health. But, you know, and Ruth, maybe if you can speak to this. You have led dialogues, and I don't know that you've, how many railroad trains you've conducted, but you led dialogues in crude oil shipments. She's led dialogues in greenhouse gas emissions and in other human health issues. So, Ruth, please.
Are you okay? Are you talking to Ruth Garrett?
Yes, ma'am.
Okay. Yeah, I get lots of support from Frank and from ICCR members and from Series. So I don't have the expertise. I just try to keep it going and send the letters out and connect for when we need to dialogue. But yeah, I wouldn't be able to do it without the support of experts. And also back to the letters, I appreciate, I sign a lot of them, and it does give me kind of an overview on that issue and what's going on. So it helps me keep in tune with what's really important, the issues are now. And I think it's got to make some difference to the company, especially if it gets followed up with dialogue or resolution.
Somehow, if you have to put your thoughts into writing in a letter, you organize and form them better. They become, I don't know, a more cohesive ask than if you're just dialoguing. So I think there is some benefit to putting these in writing. I don't know how you measure that benefit, but I think there is something to be said.
Definitely.
And you've also kind of dipped your toe in the healthcare area. Have you listened in on some of the dialogues concerning these pricing resolutions?
I'm trying to think. There's been a dialogue with Abby, but that's separating chair.
Right. Right.
And that's the first time we've led on a resolution is AbbVie this year. And I definitely relied on you and others from ICCR to join on that phone call because I felt inadequate myself. So we definitely do get a lot of support.
Yeah, and I think, as Ruth will tell you, the main thing, from our leaders, from our members, is to speak to why it's important to your community, why it's important to your institution, to be the moral voice. It's not, as Ruth Garretts will tell you, doing a 2-degree scenario analysis for a utility is not, she's not steeped in that detail. On the other hand, she can speak to why care for creation and climate change is important to her community and why companies should pay attention to this, both for societal purposes, but also their long-term longevity. So I think that authenticity that a faith voice brings, that the unions, the pension funds, the state controllers, and the BlackRocks cannot do that. They can't do that. So I think that's what we're looking for there.
And I guess I would add is that even in this area of health, especially with so many of our women religious communities that are a part of Seventh Generation, a part of ICCR, the work in health, whether or not you're still running a hospital, is part of the DNA of those religious communities. That it's part and parcel of who we are.
Good. Well, Chris, I think we're at our end of our time. So
yes, we are. Thank you, everybody. This has really been, and I appreciate the dialogue here at the end where we've engaged more of us. I know that not everybody had a chance to speak so much here, but I will be sending out this afternoon a link to the video of this webinar. I'll be sending out the slide deck to everybody. And as we get more information on different parts, so for instance, if we can get the data on what's spent on research and development and on the development of business from the pharmaceuticals, that would be really helpful to be shared with members. And I'll post that on our website. And we've got our member meeting next month here in Milwaukee, well, actually in Elm Grove at Dana Investments office over there. And that will be May 11th?
No, 14th.
14th, thank you. Board meeting on the 11th, May 14th for the meeting, the member meeting there. Notices will be going out on all that to you. Thank you, Donna. And in their absence, thank you also to Marty and to Meg for their parts. And Sister Ruth, thank you for leading us in the prayer. Sister Ruth Battaglia, that is, for leading us in the prayer at the beginning. And have a great day. We'll see you.
Thank you very much.
Yes.
Thank you.
Thank you.